Good day. With this presentation, I'm going to give you feedback on the ankle and lower leg practice cases that I've given you. I hope that you've completed the opinion form, so have that as hand and then self-mark as you go along. So for our first case, we have a patient who was referred with a history of a dog that ran into his left leg, and there's now painful around the knee area and also the fibular area as well. So if we look at the AP view, and let's just zoom in here. First thing that we should do is to check for alignment. So when we use our ruler, we're able to see that on the medial side, the femoral and tibial condyles line up. Over on the lateral side, when we draw our lines, we can see that there is a substantial amount of the tibial plateau that's been pushed outwards, and that indicates that there is depression or compression of the lateral tibial plateau. So if we zoom in further, we'll be able to see these lucencies around the lateral tibial plateau. In terms of the femoral head, very difficult to see if that has been affected. And let's just get rid of all the measurements. Okay, so if we look then at the lateral view of the lower limb, it's difficult to see the fracture on this lateral view, but what we can note is the lipohemothrosis above the patella. So then when you complete the opinion form, you'll be able to note that the alignment has been affected. We saw that on the AP view. We are also able to see that there's a fracture of the bone, so you should tick the bone as well. And then, of course, it involves the knee joint, so cartilage is affected, and the soft tissue has been affected because we saw with this the lipohemothrosis. So the main comment that you should have here is that there is a compressed or depressed fracture of the lateral tibial plateau with associated lipohemothrosis. So the next case is that of a pediatric patient who was referred after falling off his skateboard. So if we focus first on the AP view, we are able to see that there is a lucency. So here is the epiphysis of the patient. We can see there's a lucent line going across. The ankle joint itself looks intact. The lucent line doesn't look like it's going across the interarticular surface, so it appears to be lower than the epiphyseal plate. However, when we look at the lateral view, we are now able to see that there is a lucent line above the epiphyseal plate. So that actually indicates a Salter-Harris type 4 injury because it's above and below. So it's gone through the epiphyseal plate. And then also what we can note on this image is there is some soft tissue swelling here. And there's a normal variant at the posterior part of the talus, and that is an osteogonum and shouldn't be confused with an avulsion fracture. So the main findings then for this case is that it's a Salter-Harris type 4 injury and with no other significant displacements. So for case 4, we have a patient who's been referred after kicking a wall, and there's deformity of the left lower leg. And there's a couple of images attached to this case. So the first thing that we note on this AP view that we have is that there are multiple lucent lines, and that indicates that there is a comminuted fracture of the distal tibia. Always important to also then look at the head of the fibula to see if there's any associated fibular fracture. The next view that we have here is a lateral view, and that confirms that there's a loosened lines across the tibia, but we can also see that the fibula appears to have a fracture. So the other AP view, which shows the ankle, it shows on the tibia that the comminuted fractures does not extend into the articular surface, and on this AP view we can actually see the sclerotic appearance of the fibula, which indicates the fracture. And the additional view that they've taken then shows that there is also a fracture of the fibula, and again doesn't involve the articular surface. It's a bit of compression of Kager's fat pad. So our overall comment then here is, if we look at the ABC's form, so there's been mildly displaced fractures, comminuted fractures of the tibia, and also fracture of the fibula. And so the bone has been affected, the alignment has been affected, and then there is some soft tissue distension here, but the joint is not affected. So case 4 is that of a patient who's been referred after an injury to the ankle, and also noted in the clinical notes that the patient is obese. So let me just see if we can make this a little bit lighter. Yeah, that's a little bit better. So we can note with the fibula that there is a fracture. It is above the ankle joint, but there is some valgus angulation of the fibular fracture. There's also a transverse fracture of the medial malleolus. And when we look at the joint itself, the talus has been displaced laterally, so about half the width of the mortise. So the attachment to the tibia itself, so the tibio-talar joint, has been affected. On the lateral view, it doesn't give us much more information. The only thing that we see here is that there is a normal variant, there's a calcaneal spur, and then also there's some soft tissue swelling, and there you can note that there's some arthritic changes to this patient. So then in terms of the opinion form, alignment has been affected, the bone has been affected, the joint has been affected, and then there's some soft tissue swelling as well. So we have a fracture of the fibula, of the distal part of the fibula, with valgus angulation, and then also a fracture of the medial malleolus, and there is lateral displacement of the tibio-talar joint. So our final case is that of a patient who has jumped off a ladder and has a very sore heel. So let's first focus on the AP view. So in the AP view, there's not much that we can pick up. The only thing that is noted here is a benign tumor, which is a non-ossifying fibroma. It is asymptomatic. So it's something that's quite often picked up incidentally. However, if we look at the lateral view, we can note that there are multiple loosened lines, that these lines go across the articular surface, and we can also measure Bowler's line, which Bowler's angle, which I've measured here, and it's about 12 degrees. So what it shows is there is severely compression of the calcaneus on this view. There is an additional view, and it's the axial view that's been taken. And on the axial view, we can note that there are these multiple loosened lines as well. So then in terms of the radiographic opinion form that you have, so let's just bring those two in again. We can note that the alignment has been slightly affected because there's displacement here. And then also, of course, the bone is affected, the cartilage has been affected. And then if we look at Kager's fat pad, there is some displacement there as well. So the overall comment then would be that there is an intra-articular comminuted fracture of the calcaneus that goes into the subtalar surface, and there is severe compression of the calcaneus. So those are the 5 cases that I've given you. As you go along, if you've got any questions, always feel free to contact me. Thank you.